Hello, welcome to my channel. My name is Karen. I'm a clinical psychologist and I use brain working recursive therapy, or BWRT for short, because it is a super helpful neuroscience technique that works to alter and physically change unhelpful patterns in your brain. It reduces or even permanently erases the anxiety, stresses, and triggers that lead to an unhelpful brain reaction. In this video, I'm going to talk about my personal experience with BWRT, which is how I got into BWRT, how I found out about it. And then I'm going to talk about how I incorporate it into my practice and into my sessions, in the hope that it will help you to make a decision about whether BWRT might be something that you should consider for you. I personally discovered BWRT in August 2020 when I had a really awful trauma at the dentist. In the midst of the procedure, something went horribly wrong. And what should have been a simple cosmetic procedure turned into an absolute horror show. The physical pain was pretty bad, but what was worse was the psychological aftermath, the way that I felt afterwards. For the next few days, anything that touched my tooth would set off a chain reaction of panic in my body. And you know, the thought of going back was unbearable. But I could hardly spend the rest of my life walking around with an ill-fitting temporary crown on my front tooth. I had to go back. I knew that my friend and colleague had recently done this BWRT course, and I knew that it was supposed to help with trauma. So I called her and asked if she could help me. And she said, sure, let's give it a try. We did the session over the phone, and within less than 30 minutes, everything had changed. At the time, I was in such a state that I didn't even listen to the instructions properly, but nevertheless, it helped. I went from being in like a 10 out of 10 distress level to about a 5 or 6 out of 10, which wasn't perfect, but was definitely good enough to enable me to go back to the dentist the following day and finish the procedure. I felt an instant improvement, an instant calm. And you know, the next day I was really not happy to go back to the dentist, but I was able to go back and finish what needed to be done. And I even managed to stay quite calm. From that moment on, I actually couldn't wait to get trained and certified in BWRT myself. Only certified mental health practitioners are allowed to use BWRT. It is a specialist technique. It is a standardized technique. There is a protocol that is followed, but how each clinician interprets that protocol and administers it might be a little bit different according to their personal style. As a therapist, I use BWRT in accordance with my personal therapy style. Generally, I use it as part of my holistic therapeutic approach. If you're finding this video useful or informative or helpful in any way, then please click the like and subscribe buttons and turn on the notification bell. I have generally found that one BWRT session in a session is enough for my clients, but it is possible to do 2 BWRTs in a single therapy session. Did you know that your brain and body respond in the present moment, regardless of the chronological order of the memories that are stored in your brain? When you're triggered or you have a flashback, even if the thing that caused the flashback happened long ago, it unfolds in the present moment. So you can choose any memory. It doesn't matter whether the thing happened yesterday or happened when you were a small child. If you remember it and you can access that memory, then we will be able to use BWRT to change your response to that memory. So in terms of how BWRT session is structured, I like to spend some time explaining how everything works to my client and making sure that my clients and I are on the same page. Then I use the BWRT protocol to guide my client through the stages of the BWRT. You do have to think about the memory or the trigger, and you do have to go there and experience the pain and trauma, but it is very, very brief and you are in a safe space. The thing is that when you have a flashback, when you have a phobic response or an anxiety attack, then these things are happening anyway. You are experiencing those horrible feelings completely out of your control anyway in your daily life, because you don't know when it is going to be triggered, do you? And it could be at work, it could be while you're driving, it could be anywhere at any time. With BWRT, it's controlled. You go there, you spend a few seconds in the hard, bad, difficult, painful place, and then we shut it down and it never comes back. As painfully or horribly as it currently already does. Because BWRT will relieve or reduce the symptoms that you experience. BWRT can feel a little bit like hypnosis. When you open your eyes, you feel like you've gone on a journey, which you have. But the journey is of your imagination. You are an active participant in BWRT. As the client, you come up with your own strategies as part of the process. Afterwards, most clients tend to tell me that they feel good. They're often really surprised that they feel good. Sometimes, depending on the content of the specific BWRT process, it might leave someone feeling sad, but it is normal sadness, natural sadness, not the traumatic horror that they originally felt. And the thing is, BWRT is not going to turn anyone into a robot. BWRT takes away the extreme intensity of distress. But of course, it doesn't remove your normal memories and your normal sadness when you think about something awful that happened. But you would no longer experience or re-experience the awful thing as if it's happening in the now. The success of BWRT actually depends on you being wide awake and actively using your imagination. Don't worry, if you're not someone who likes to use their imagination, it's a guided process. BWRT has only been around for a few years, but it is a neuroscience technique that is solidly backed by evidence, and it is a growing body of research because a lot of psychologists are starting to use it, and I think it's going to become more and more popular. BWRT isn't some kind of magic bullet, of course, but one of the very best things about BWRT is that it cannot harm you. Even if your distress is not reduced or it's only reduced a little bit, it cannot possibly make things worse. In terms of the setting, you need to be in a quiet place where you will not be interrupted. But the interesting thing about BWRT is even if you are interrupted, it's not the end of the world. It's just a case of going back to the step that we were in and starting again at that point. You don't even have to start at the very beginning. For me and for many of my clients, BWRT represents freedom. Because it is almost impossible to go through life without negative, painful, and traumatic experiences that haunt you. This is very normal because of the way that our brains are wired. And BWRT provides a solution to this. It's a kind of key that unlocks a more helpful and more adaptive and more useful response. If you'd like to know more about how BWRT works, then please watch the video that I made about how it all unfolds in the brain itself. Thank you very much for watching. I hope to see you again.